Hi, I'm Marybeth Van Horn, and welcome to Nurse Chats. I want to just talk today a little bit about foot care. When I was a home nurse, we did a lot of foot care for our patients, and oh boy, we see everything with regard to feet. You can't believe the poor feet, what they take in life. It's a beating, and it's not easy, to do foot care for a lot of reasons for a lot of people. Either they can't see well, they can't bend that far to get to their feet, for arthritis reasons or obesity reasons or a number of reasons. They can't reach their feet. And so the feet get neglected. And when we do foot care, the first thing we do is soak the feet so that the bacteria is eliminated and the nails become soft, the cuticles become soft. There's again a lot of reasons for a foot bath. Your feet are important. The whole study of reflexology is about feet and the related organs that correspond to different points on your feet. So there's a lot going on there with feet, and you should honor your feet. Take care of your feet. If you can't take care of your feet, really, truly, I believe that there's tons of foot care options now. They have foot care clinics for Medicare recipient patients that are in assisted living. I know I have a friend who does foot care at assisted living as a business. I mean, there's several businesses now just for foot care. There are, of course, beauty shops, but if you go to a beauty shop that does feet and nails, or nails, I should say, you should, a pedicure and manicure, you should make sure that the foot bath has, I would say, a disposable, removable cover on it, because you can't get a fungus from a foot bath, even if it was cleaned. Somebody might have missed something. And we talked a different nurse chat about bacteria. Bacteria is sneaky. So if you miss a spot, there might be bacteria. So definitely that would be my caution there. If you go to get a pedicure, make sure that the practices at that particular place are using a disposable cover that only is used for you. And then their equipment should be, sterilized. My pedicure place, she opens a new package every time. So they must package them after they're sterilized or whatever they do. If they're metal, they sterilize them. If they're disposable, that's different. So you never want to dig at the sides of your nails on your toes. That's a great way to get an infection. You don't necessarily want to round out the toenail either. And that's one way of getting, the skin to grow up and get an ingrown toenail is rounding your nails. So generally, most people who do foot care will cut the nail across, straight across, and not round out the edges like that. Maybe they might take a file to it just so it's not sharp, of course. We don't want that either, digging into your skin, but we definitely don't want to get people to develop ingrown toenails as well. Toenails that are too long are very uncomfortable in shoes. If you're wearing shoes, again, some people just wear open-toed slippers a lot, but you can get an ingrown toenail or a fungus or pressure from the shoe on the toenail that is too long, and that can cause problems. Again, corns are caused by tight-fitting shoes, and nails that are too long. Pressure on an area causes a corn, which is similar to a callus, right? Those are no fun either. So if your toes are crooked, which 90% of the people seem to have crooked toes from arthritis and whatever else happens to toes, then you can have areas that are rubbing. You can have difficulty cutting your nails. Of course, that's what we're talking about when your toes are crunched on each other like that, hammer toe and that kind of thing from bunions. Filing the calluses on a foot, also, it should be done by a professional, because overzealous filing can lead to breakage of the skin, which can lead to infection and sores. Obviously, people with diabetes have, it's well publicized that they can have serious problems healing from any injury on a foot. So you don't want to risk that if you're diabetic or even pre-diabetic. You want to have the right person working with your feet. To do your own foot care. We've been isolated and quarantined. So my guess is that people have been having a trouble even getting into an appointment with a professional. And that may be one of the reasons that they were one of the first businesses to that they were talking about opening up. I was thinking of salons, and I was thinking, why do we need to open a salon? I mean, nothing against the salons. I love my nail people and I want them to work, but I just was worried about COVID, and I was thinking that seems like a breeding ground. You have to be very, very careful with everybody in a mask in that place. And but now I realize it extends to foot care for people who can't do foot care. It's not just for, glamour nails and, stickers on your nail. It's for a real purpose. And so, again, we as nurses do foot care. Nurses' aides don't do foot care. There's a reason, right? So I should say CNAs, assistants. We used to call them nurses' aide, but they don't do foot care. That's relegated to a professional. And foot care included massaging the foot and moving that circulation. Oh my gosh, I had so many patients that really, truly needed that. And of course, it's so relaxing. There's always multiple benefits for everything we do that's beneficial to the body. If you do one thing, there are multiple rewards, and that would be such as relaxation and touch and human contact, talking, the things that happen when you're doing personal care for a person. But foot care, again, overgrown cuticles and skin around the toes, they get trimmed away for a reason, to reduce bacteria and fungus, okay? Fungus is even more important than bacteria, more prevalent than bacteria when we're talking about feet and foot care. So fungal toes and fungal infections in the feet are a problem. And you have to, try to work with creams and medications and whatever you need to. But keeping the toenail in good condition and the foot in good condition will help that. And there's lots of tips on fungus. And I can talk about that in an email personally if a person has fungus and wants to know more about that. And about foot care in general. It's important, but not just for the elderly. It's important for young people. I can't tell you how many young people walk around with calluses. People I know, I'm not going to say who, people I know walk around with calluses that are unbelievable. They carry dirt because they're rough skin, they're cracked skin, whatever. Walking barefoot, walking in flip-flops, walking in the same flip-flops for a year, it matters. And, the foot covering, I'll get into that maybe again on another nurse chat, but what kind of shoes you're wearing and what you're wearing every day to protect your feet. These are important things, but all I know is that it's not one age group that this affects. Fungus happens on many people for many reasons, and calluses and cracks and, that kind of stuff. So as I always say, if I don't know the answers, I can probably find them for you, because I know a lot of people. I know a lot of nurses. I know a lot of doctors. I know people. And you know what? I've done a lot of things in my life. I was a nurse, my nursing career stretched into many things, including being a personal trainer and working with exercise and nutrition, including when I had little babies and I did home daycare. I still use my nursing. And I was a paralegal for a very long time, and I used my nursing. And so I always said when I was a paralegal, the greatest asset of a good paralegal is all the resources that she has, all the people she knows, what resources you have to research something, because you don't have all the answers. Guess what? You might think you do, but anybody who thinks they have all the answers, you might not want to deal with that person, because you got to know that what you don't know. Okay, so I'm happy to research for you or go to bat for you and figure it out with whoever I know. Okay, and help you. That's why we're doing this nurse chats, especially during the quarantine right now. But many communities are having me do it after the quarantine because they're so valuable, and I'm really happy to be of service.